So my name is Shruti Patwal, and I'm currently
Mm.
in my fifth year of Doctor of Pharmacy. And I'm
Okay.
also serving as the Vice President for IPA-SF Pune Branch, who I'm representing here today. That's Indian Pharmaceutical Association Students Forum. And basically, we are a group of pharmacy students that work together for raising awareness about the profession of pharmacy, and
Mm.
serving to the community as well. And with the
Okay.
same, yeah, and with the same objective in our minds, we have started this podcast. It's named as the White Coat Talks, because we see pharmacy students going around wearing white coats, being happy and taking
Yes.
pride in it. It's a great honor to have you as a first guest also for this series. I'm really excited to talk to you about it.
Thank you very much for that.
Yes. So, sir, I'll just start on an honest note. I just wanted to know, like, what do you think that what's the pace of India in the space of digitization when compared to other first world countries?
Okay. I think first thing first, Indian healthcare have seen the dramatic change after COVID. See, pre-COVID and post-COVID, if you see healthcare, I think COVID act as an enzyme to speed up the healthcare digitization process. I'll give you two scenarios. Pre-COVID, most of the doctors is afraid of coming on the virtual platform. It is very difficult to catch start doctors on a virtual platform. The patient has to actually travel to the hospital, far-flung areas, tier 2, tier 3 city, to the metro or a big cities for the consultation. And there, the typical, queues in the OPD, then they have to go from radiology, pathology. I think adopting digitization is becoming a mandatory now. So like say, you must be seeing BlackBerry, and now you will not see BlackBerry smartphone, because BlackBerry has not changed with the time. So healthcare has seen a dramatic change into the healthcare because of digitization. Earlier, people used to say, okay, hospital is like a shipping industry. Shipping is very slow in adopting some technology. The digitization is less than 10%, and now it is 62 per percentage. So I think India is very slow in adapting new technology when it compared to nation like US and Australia. And the reason for that is there was no impetus. Now I think we got the impetus, and India is doing a great thing into the digitization of healthcare. Healthcare is moving away from the hospitals. Hospitals are only meant for your operation theaters, procedures, critical care. But I think it is going away. OPD you can do by virtual consultation from a doctor. Pathology, you can do a home healthcare, where most of the hospital have adopted home healthcare, where the fellow botanists and technician come to your home, take your sample, and you get the report in your hand. So it is a changing of era in Indian healthcare. And you see 50% of the Indian population is surfing the net now, which was not there. If you see, across, we are talking about 2G, 3G, 4G, and now 5G. So internet penetration is there. Few days back, Honorable Governor of Gujarat come to our hospital, and a medical officer team was with him carrying the reports, CT scan, MRI, radiology, pathology, while showing the doctor. And it is very tough for a doctor to see all those reports, keep on seeing. So now Indian healthcare is changing. There's a digitized card. Every report is available. While you sweep the card, you can see the entire reports. So you can correlate. So instead of you walking and walk out is paper free. So it is not carrying the report. You can see the reports in a digitized form. And if you see, there was one study, which was talking about how much time does an average person spend on healthcare professional. So if you see a doctor, a clinician spend just average 5 hours interacting with a clinician in the entire year, just 5 hours in the entire year. But the rest of the waking hours, that is 8,755 of them, patient are looking after themselves. If 8,000 plus hour patient is looking after themselves, so it means how patient will take care of themselves. Patient is taking care of themselves by a way of technology. So by monitoring, by remote access. So I think that is the way we are connected with the patient. So now we are connected with the patient through Apollo 24 by 7. So it is a technological platform. So reach is more. Earlier, we can see the patients within the city. Now we can see the patients across the border. So because of digitization, the reach is more. See, India is country within the country, right? So you cannot reach everywhere. But I think with digitization in the healthcare, India is fast pacing in adopting digitization, because we have to learn from the West. And we have to be, now India is proceeding very fast. I think government of India is also very sensitive about that. They are talking about e-record. Earlier in the court of law, e-records are not available. They're not
Hmm.
allowed. A hard file used to go. But now I think with the advancement of technology, medical records is also become e-records. Otherwise, medical records is full of patient files and all. So I think India is rapidly catching up with the first world countries, and so many apps, so many patient care application. As I told you, around 8,000 hours patient had to spend themselves rather than 5 years with 5 hours with a clinician. So I think the technologies connect between the healthcare and the patients. So if we are not adapting technology at the fast pace, we will not grow to that level.
Yes, sir, I very much agree to that. And I, also agree to the point wherein you said that after COVID, we just got that impetus and people started trusting technology. Because
Yes, you are right.
before that, yeah, before that, if we talk about the reason, maybe it was the resistance to the change in the, the routine things that we used to do. And
Right.
also maybe it was the population. And until,
Yes,
yeah.
you are right.
Until then, people were just like, with such a huge population, will the technology even be able to, provide to so many people? But just
Yes,
COVID showed us that technology was much more than we just thought of it. So, sir,
you are right.
yes, sir. So, sir, except these 2 points, do you think there was anything else that was, being a hurdle to the digitization in healthcare for India?
No, I think government also become very sensitive. Now, if you see in parliament also, 70 to 80% questions are talk about healthcare, and healthcare is becoming the front end. Earlier, I think government of India was also not sensitive about healthcare. If you see the percentage of GDP which they allocate to the healthcare is less than 2%,
Yeah.
vis-a-vis the first world countries, which is around 6 to 8%. So now I think the insurance schemes are there. Government is giving the allocation to the healthcare. If you see, most of the medical colleges is coming up in various states. Now the seats, the PG seats have increased from 18,000 to 50,000. So I think government is also doing, like, if you see the number of nursing colleges, pharmacy colleges going up and up, and with the help of NABH accreditations, I think the importance of the paramedical staff is also very, very important. So I think COVID is one factor, but I think in combination of all those things, I think in order to reach more people and an affordable healthcare. Suppose I'm traveling from 200 kilometers, I'm taking a train or a bus, I'll reach the hospital, I'll wait for the doctor. But if he is available on my cell phone, something, whether I'm at home, whether at my workplace, I can consult a doctors and do the treatment accordingly. If I require a pathology, I'll call pathology at home. If I'll require radiology, I can do that, and I'll get the report on the phone only. So I
Yeah.
think apart from COVID, many other factors have changed, and the penetration of net also, as I'm telling now, 50% of Indian population under the ambit umbrella of 3G, 4G, or 5G. So I think that is very important.
Yes, sir. With 5G, I guess, the speed of digitization is just going to boost even more.
Yes, you are right. You are right.
Yes, sir. So, sir, talking about the role of pharmacists in the healthcare industry, we do know that it's important. But, there's a common thought process for all pharmacy students that we really do not know. Like, we do not think that there's much substance to pharmacists in the hospital and healthcare setting. So, what is your view on this? Like, what role do pharmacists
No,
play
no,
and how important are they?
no. Yes, yes. I think pharmacists today do much more than dispensing drugs.
Hmm.
See, if you see, 15 years ago or 20 years ago, pharmacies are limited to dispensing drugs only. I think that is one of the so many jobs which they are supposed to do. Today around 53 percentage of licensed pharmacists are doctors of pharmacy, you know, who receive as much as classroom clinical instruction as well as medical doctors. To see the level of knowledge and expertise what they have. Now see, in our hospital, say for example, I work for a corporate hospital. We got a 72 hospital across the country. We have around 12,000 beds in the country, and I think Southeast Asia, one of the biggest healthcare Apollo. There is something known as Farm D. There's a doctor of pharmacy people. We are having around 42 doctor of pharmacy placed in our hospital to spend more time in the hospital than to the pharmacy colleges. They've been posted across various floors, various departments, and they play a very, very important role. See, since the start of COVID pandemic, again, I'm telling you, nearly 1 in 3 people are most likely to visit pharmacy for advice before seeking help anywhere than they were before COVID-19 pandemic. This is a survey which I'm talking about. So if more pharmacists were to operate the full potential of their professional education and skill set, see, they could play an important role in elevating the behavior of healthcare consumers. My clinical pharmacist call up a doctor and say, hey doc, you are not prescribing the medication as per hospital formulary. You cannot prescribe this antibiotic because it is not in the hospital formulary rule. I think that is a role of a pharmacist. That is very, very important. So what I feel in India for the future for healthcare vision, what I feel, healthcare will shift away from the treatment and toward prevention and well-being, and with care increasing taking place at home or the community. See, as of now, if you see healthcare, what do you feel? Healthcare is hospital, hospital, hospital. No. So I think the future of healthcare vision, digital. So it is moving away from hospital to home and in the community. Like we do so many camps, our pharmacists dispense the drug. Our hospital formulary is maintained by a pharmacist. We got a pharmacy and therapeutic committee. So if any doctor is prescribing a medication which is not in the hospital formulary, then he cannot prescribe just like that. So what he's supposed to do, he has to write to a PNT committee, which is pharmacy and therapeutic committee, and that approve the drug. Otherwise, he has to prescribe from the formulary. I think in India, you can purchase antibiotic just like that.
Yeah.
But in the Western world, you cannot just prescribe medication just like that. And then I think pharmacists play the very, very important role in the prevention and well-being of the community and the people. So I feel the primary care, which they are doing, the digital health, I think so many startups have come, which is talking about, you must be seeing NetMeds, MFine, so many, Apollo Pharmacy, 5,000 pharmacy store across the country. So they are not only talking about dispensing drugs, digitization, but I think population health analytics is also very important from the pharmacy point of view. What is the behavior of a disease pattern? What is the prescription which doctors are giving? Like in India, broad spectrum antibiotics is most common. I think antibiotic is not a first choice, right? So therefore, I think the role of pharmacist in the public and population health bound is very important. But pharmacists has to raise to the occasion. They have to live like clinical pharmacists, which makes the things very easy. Like NABH, what the Quality Council of India advocate, the role of clinical pharmacologist for every 100 beds is mandatory now. So if you are having a 500 bedded hospital, you should have minimum 5 clinical pharmacists, apart from the pharmacies which is available in cath lab store, operation theaters, outpatient pharmacy, inpatient pharmacy.
Yes, sir. So even being a pharmacy student myself and hearing the bright future that you just presented and the recognition you gave to our post, it it feels like an honor, because I remember a few years back, like when I even used to tell people that I'm a pharmacy student, and they used to tell, what is it, diploma in pharmacy? And it used to feel so bad, kind of, because we are doing this 6-year course over here, studying the therapeutics, studying pharmacology of drugs, and people just not recognizing it. And coming from you, like the things that you told us, like such an honor. And I'm not even able to find the right words about how happy I am the way you explained everything. It just feels very nice. And talking about Apollo Pharmacy is widespread, because there's an Apollo Pharmacy back in Mumbai where I live. It's in my colony itself, and just a few 2 to 3 kilometers again, we have an Apollo Pharmacy here. So yeah, so there's that. And I really hope
Yeah.
that people, start realizing the importance of pharmacy soon enough, because prevention will obviously be the first thing to adapt if
First choice.
pharmacy.
Yeah, you are right.
Yeah.
You are right.
Yes. So, sir, with the increasing pace of digitization as well, and talking about pharmacists, growing in the healthcare sector, what do you think that budding pharmacists should learn about digitization, or what would be your advice to the budding pharmacists for surviving in this digitization?
See, I think the pharmacy, I go to some of the management colleges to take some classes. I think the digital transformation is underway, right? Business across all the industry, not only in healthcare, are leveraging technology, to change, to improve the way they operate and service their customer. Earlier in our time, there was no call centers, right?
Mm.
Now, wherever you go to give your car for service or purchase a car, you automatically get a e-feedback. Whether you take a flight, you will get a feedback. So I think digital transformation is not just a buzzword, what I feel. It is a standard that many businesses thrive towards. So healthcare sector, if you see, so many opportunities are there. So in order to reduce cost, in order to improve efficiency and enhance safety and clinical outcome, the role of pharmacists is paramount importance. Now I'll say how it will happen. See, for example, you can monitor the doses, you can monitor the pharmacy entire software through a platform known as pharmacy software. So now, in any patient bill, 35% of the bill contribute pharmacy. Pharmacy, like doctor cost, hospital cost, pathology, radiology costs, as well as a pharmacy. 35% of the total bill constitute medicine, consumable, and pharmacy. Number one. Secondly, the examples of digitization in pharmacy. I've seen students are not using the technology. If you see when a doctor prescribe the medication, what doses and all. So now there's a digital software, something like a phone, handset, PDA device is available to a staff nurse and a pharmacist to check the expiry of a medication. Now I think the new software is giving a medication which is coming with a QR code, so you can
Hmm.
say whether which medicine is dispensed, expired or about to get expired. So now online prescription renewal. See, because some prescription floats around, one, twice. So online prescription renewal, selling product online. See, you must be seeing Tata, 1mg. Everybody is coming to the pharmacy. Why? They're coming because pharmacy is a key driver in healthcare behavior. Now, mobile apps are there. Online appointment booking for wellness checks are there. Home delivery and pickup coordination is happening. Now there is one application which is known as MFine. So they started with the doctor software with the consultation. Now they are linking doctor consultation with pharmacy. So what they do, they have taken around 300 odd pharmacists and clinical pharmacists in the startup. It is a startup which is around 550 crores. They have put up money. Now they have a panel of around 300 plus pharmacists. So they monitor the prescription which is given by our doctors, and this medicine is reaching their homes. So I think apart from hospital pharmacy or a standalone pharmacy, the requirement is in healthcare startup. The requirement, the company which is making healthcare pharmacy software. So the requirement is that, and I think digitization is the future, and pharmacists is a future pilot for healthcare. That is my personal thing, which I always say whenever I interact with pharmacists in the hospital and outside hospital. Whichever can we do. Apart from doctor and nurse, we also send a clinical pharmacist also. So I think it is very important. But somehow, I feel the shortage of pharmacists is there. So therefore, institutes are very less and demand is more. So I think the gap has to be made, and some sort of education has also be changed in the term of using of software and digitization if they use technology. Because Abhi, if you go to a pharmacy store, you see the medication. So expiry, you have to actually check. So if it is coming with QR code, so I think it makes a difference. So I think requirement of pharmacists is there because this is made by engineers and technocrats. So I think they can able to help them.
Yes, sir, definitely. And I really like the thing that you said that digitization is the flight and pharmacists are the pilots over here.
Pilots, yes, yes.
Really like the quote. So, sir, this is a little off topic, but I was just going through your LinkedIn profile as well, and I really liked it, by the way. And there I saw that you were involved in various leadership roles throughout your life. So,
Yes.
what are the key things that you learned being a leader, which you would love to share with the young generation?
Okay. See, there is one saying, Shruti, which I've heard: "As is the king, so are the subjects." So whatever the king is, the subjects are like that only. So I think importance of leader, good leader in effective healthcare system is very, very important. I think, say for example, uh, leadership has been seen best in healthcare during COVID times, when no doctors is coming on duty, staff nurse, their parents are coming, they are asking, our daughter, our son, not supposed to work into the hospital. So we have released one book which is known as Smile Behind the Mask. So it is a good book which is sharing the experiences of our doctors, our nurses, our pharmacists, and our technical staff. So while they are behind the mask, you know, where is the smile which we have seen in these people? And what I have done in the hospital as well as our Apollo group, what they have done, they have captured these smile while talking to these people, and they've compiled one book.
Oh,
And it is talking about those people, the story which was never heard. It was just a small smile. That smile, maybe her father is not well, but she cannot able to go. In COVID, we got a very frenetic call from Ahmedabad. There is 70 kilometer. There is a district known as Surendranagar,
mhm.
and they went to Apollo 24 by 7 platform, and they're asking. His son is in US, so he's calling and saying, "Okay, my father require these medication, and he is around 70-80 kilometer away from the hospital." You believe it, Shruti? A pharmacist in his two-wheeler bike, he went to 80 kilometer and giving that pharmacy back. You believe that is known as smile behind the mask. So I think if you compile all those stories and you create some outcome moment or a life moment, I think that's me. And you celebrate with the team. See, I think that is very important. Like we have so many patients in the hospital. So one mother father was crying one day, okay, my son is not well for the last 1 month, and we came to know from his hospital record, okay, it is his birthday. So along with the cake, our team went inside the ICU, call his parents and doctor and celebrate his birthday. So her mother was crying, she was crying with joy. And see, it is not at all possible, and I think that makes a difference. So what I feel, a leader is that we smile with everybody, right? But smile is always behind the mask.
That's a very, very wonderful thing that you said. That's like a really wonderful thing. And I really like the initiative of Smile Behind the Mask, wherein you showcase the stories
Yes.
because it is very heartfelt. And there are also healthcare people, who strive so much into healthcare and are always about giving it to people. But no one knows what goes on behind those smiles. So with this initiative, I'm very sure that it brought us smile to a lot many, healthcare students,
Yes.
healthcare staff, because even I'm smiling right now because it's such a wonderful initiative.
Thank you. Thank you.
Yes, sir. So, sir, that's it from my side, all the questions. And so it was really great talking to you. You are an amazing person. and it feels like an honor to have you over here. And I'm very much grateful that you gave your time to this, adjusted your time to this. So,
So
sir,
thank you very much.
thank you, sir. Thank you, sir.
Take very good care of yourself. Convey my best wishes to the team members. Thank you very
Thank you
much.
so much, sir. Thank you so much. It was really an honor.
Namaste.
Namaste.